think most patients are surprised how quickly we get them up and mobilize them. It used to be that patients would lay in bed a period of time after surgery and wait for them to heal before they started to get up and exert themselves, when in fact we really encourage early mobility to prevent complications from the surgery. Physical therapy is one of the most critical resources a patient has following their surgery for hip or knee replacement. We're the ones who really, after that initial surgery, get the patients up for the first time. We reteach them how to walk using gait devices such as a walker or a cane. In most cases it's a walker. We teach them how to get in and out of bed. We teach them how to do all those things that they need to get back to the life that they had before and want again without all the pain that they had. Patients who have surgery at the Nebraska Medical Center can expect to have physical therapy the morning after surgery. That's when they'll have their first session, and they'll have 2 sessions of therapy a day. That first session we aim to get the patient out of bed and increase their sitting tolerance so that they get used to being upright again. They've been laying flat for a period of time from the surgery. We have them sit up for a half hour to an hour if everything's going okay the first morning, and then we'll come back again in the afternoon, and that's when we'll start working on exercises and walking. The exercises that we generally start with are bed exercises, so patients can lay in their bed, make sure that they have pain medication before we start. And then for knee replacement, we'd work on knee range of motion and strengthening, and for hip replacement, we work more on stability and strengthening. And then as soon as we can after that, we get the patient up and walking. We usually try to walk 20 to 50 feet the first day and progress patients from there. Every patient is a little bit different, and sometimes patients get out of bed that first time and feel incredibly better because most of their arthritic pain is gone. They just have the incisional pain. Other patients find it more challenging because they're limited as far as how much weight bearing they can put through their leg. They feel a little bit deconditioned or tired from the anesthesia. But we treat every patient as an individual, so we're making sure that we're doing the things that they need to get back home. We'll teach patients bed exercises. If those get to be too easy for them, we'll progress them to seated and standing exercises. We'll also teach patients how to go up and down stairs, especially if they're going home and need to access that. We have a modified car that we practice getting in and out of a car with patients too, especially the hip replacement patients. And then the occupational therapists usually teach patients how to get in and out of the bathtub or the shower. We encourage family members to be present and participate in a patient's recovery after surgery. The more that they hear information from the staff members, not only the therapists but also the other staff members, the easier and the more comfortable it is for them when they go home. But especially if a patient has a hip replacement, there are some hip precautions that patients will need to follow for a period of time, and we like the caregivers to be able to reinforce those when patients go home. Family members are good coaches, so once the patients go home, whether they have home health physical therapy or outpatient physical therapy after the fact, they may have it, they may not. So family members oftentimes become the coaches and encourage patients to continue their exercises at home so that they have the best recovery possible. The nice thing about the team approach at the Nebraska Medical Center is that we're in constant contact with the nurses and the doctors and sometimes the pharmacists and the occupational therapists so that we can really address the entire patient. We can communicate with the physicians if patients need more pain medication in order to tolerate activity. We can really tailor patients' exercise programs and their activity to the things that they used to do before surgery so that they can get back to those activities. So it's a really individualized approach.